Hi, my name is Kareem Forbes, and this is my channel, Schizophrenia in My Family. Schizophrenia has been a part of my life since I was a teen because my sister developed it when she was about 20 years old. This is my first video on this channel to talk about and learn about schizophrenia from my experiences with the illness in my family. Recently, I came up with some new ideas about what is the cause of schizophrenia, and I wanted to share them with you to get your comments and feedback. I want to know if the theory makes sense to you as it does to me. So, let's start on this journey together. First, let me give you some background about who I am so you can better understand how I came up with the reasoning. I live and work in Toronto in information technology at one of Canada's largest banks as a Windows Server systems engineer. My job is to develop new and creative solutions as well as to troubleshoot and diagnose complex issues where there is no clear solution, and I'm very creative. What, might you ask, do I know about schizophrenia? Well, my aunt had it, and my sister has it. My sister has had it since her second or third year of university. I was about 16 or 17 years of age at the time. Before, I thought my sister was a normal case as she was the only person I knew with schizophrenia. However, as I've seen more and more people with mental illness and specifically schizophrenia, the more that I think my sister is a somewhat severe case. I feel that my sister's gifts and her life were stolen by schizophrenia as she has struggled with it for her whole life. Our lives have taken distinctly different courses, and I've always wondered why. I'm also married with 3 children. I have 2 boys, Ethan, who is 16, and Logan, who is 10, and Mava, a girl, who is now 7. All 3 of them are extraordinarily talented like I was and like my sister was. I don't think that is a coincidence. Schizophrenia usually occurs when most people are just starting their lives as adults. Naturally, as a parent, I want to prevent this illness in my own children. The problem is, how do you prevent schizophrenia if you don't know the cause? Recently, I've had some sort of mental change that I can only describe as one step closer to schizophrenia, but I have no symptoms. You might ask why I think this since I just said that I have no symptoms. All I can say is that something regarding my thinking has changed significantly due to some workplace stress and dietary changes that I went through, and I can feel those changes. I believe I know why, and as a result of that, I have developed a working theory of schizophrenia. Either that, or I went a little more crazy. I read an article that mentioned that they can't find cases of people with schizophrenia born blind. This is also called congenital blindness. I had a light bulb moment. It just made sense to me, but the scientists who made the observations for these articles have some theories why, but they aren't sure why congenital blindness appears to protect against schizophrenia. Scientists think that being blind or being born blind changes the way that we build the 3D world around us, or there's some protective measure that prevents schizophrenia. I'm not sure that the theory that I came up with is true, but when I applied to all of the research articles that are out there along with descriptions of living with schizophrenia, my theory seems to fit and make sense. So, I want to explore it with you and your experiences and put it to the test. My hope is that, true or not, it will help everyone out there to better understand mental health issues and more specifically, schizophrenia. I want to frame the theory around my sister and how I observed her illness during our lives and why I came up with the ideas that I did. Schizophrenia is still not well understood after all of these years, and we have to ask why. I think that one of the primary reasons is that those with the illness don't understand what is happening to them. On the other side, the doctors and scientists also are looking at the illness from the outside in and also don't understand what is happening very well. They can only see from the outside what is happening to the patient, who is often medicated as well. Neither doctor nor patient has a good frame of reference, or maybe I should say neither has a complete frame of reference. Based on how my sister interacts with her doctor, I feel that both sides are not really listening to each other. I, however, feel like I have a foot in both worlds. I think my perspective is more complete, but not as deep as either the doctors or the patients. And that is why I'm talking to you to get your feedback. Why is my perspective different? I am what I consider myself to be a unique individual in that in my work I often have to challenge assumptions which were wrong in order to find the answer and root cause. Often with troubleshooting, I find I had an incorrect assumption that I had to revisit and then change my thinking. Doctors have their formal and clinical training to help them diagnose illness, but in schizophrenia there are no concrete tests like we have for diabetes, for example. We have guidelines to determine when someone has entered a state of psychosis, but no real tests. I think that perspective and context help us to understand things around us. I have an interesting combination of perspectives and experiences to draw from. I am a great listener and observer and have had to be. I'm a BIPOC person, so I have developed a crazy sensitivity to people and their personalities, situations around me, and in my astute and detailed observations. I'm in information technology, so I think of the human brain like a computer with a CPU and memory. I also think of the brain as a neural processor like ChatGPT, for example. I also troubleshoot issues and complex multi-factor problems on a daily basis. Lastly, I have witnessed my sister close up and have myself to compare and contrast with her. It is these different perspectives and my recent step closer to creativity and schizophrenia that I think may have driven my thinking and my theory. I've noticed in life that you cannot understand things that you don't recognize. You also cannot explain something that you have no experience with. Our family saw this illness when my sister first became ill, but we didn't know what was happening. Once you see or experience something for the first time, then you have a frame of reference, but you may not yet understand it. Then you can choose to make positive steps to improve your condition from a position of knowledge and understanding. Often, the amount of improvement is up to you based off of how much work you are able and willing to put in, and the medical care that you receive. Like in regular medicine, you can control things to a certain degree based on healthy living, and then when that is not enough, then medication is used to get you the rest of the way. I believe a similar approach already applies to schizophrenia, we just don't really understand why. But with such a poor understanding of what is happening, we only have broad guidelines on what to do to prevent or treat the illness. I hope this will change. So, with that explanation of who I am and my background, I'll start off with what I feel like is the root cause of mental illness, or specifically schizophrenia or schizoaffective disorder. I call my theory of schizophrenia the Forbes-Hayes theory to honor my mother and sister who have fought with it for what feels like their whole lives. Based on what I have seen, I think the root cause of schizophrenia is hypersensitivity. This overall sensitivity is driven by our physical senses and how strong or acute they are, and by our brain's capacity to process all of this input. Our emotional sensitivity results from these senses and our responses to what they perceive. Our brain's capacity to process our senses is increased based on the health of our brain and reduced by the trauma we have endured or been exposed to. These sensitivities can also be increased from the physical, environmental, and emotional traumas that we experience throughout our lifetimes, from conception to death. I use conception because the risk factors for illness can often be present during pregnancy and are known to increase our later risk factors for illnesses, especially for mental illnesses like schizophrenia. From what I have seen, all of the observed causes and effects, biological and psychological factors, and especially the risk factors, can be explained from this context of sensitivity or hypersensitivity, and how I believe that oversensitivity drives the illness. The theory helps to explain what that hypersensitivity means for our bodies and minds and the markers it leaves behind. From a perspective of sensitivity, we can also understand how stress creates and worsens the state of hypersensitivity, how stress makes our sensitivity worse, and how that prolonged stress can lead to a state of psychosis based on how we and our bodies react to that stress. I have seen many articles and personal accounts of the illness describing this effect, and how these risk factors increase the chance that we can develop mental illness. I have also heard from so many people who describe their illnesses, and they often start with a statement like that they were sensitive children, or they were exposed to trauma at a young age by circumstance, or through illness, or by accident. If this is correct, then the idea of sensitivity being the root cause has really significant implications. This means that we are all on the spectrum, healthy or not, and it means that any of us can develop this disorder. I used to think that I was well and my sister was not, and that we were on the opposite sides of the spectrum. I mean, it's uncomfortable to think that you may develop this illness at some point. A doctor in Florida told me that when he reviewed my family history. I have come to realize that my sister and I were actually on the same side of the spectrum, but that she has crossed the line into illness. She has passed her tolerance for sensitivity and has crossed that line into psychoses from time to time. But the hope I feel is that this also means that she can come back with the right help and treatment. I want to give an acknowledgement to Lauren on the channel Living Well with Schizophrenia, as she inspired me to do this channel, and she has greatly increased my knowledge of how it feels to have schizophrenia, which also helped me to develop my ideas. I hope to get your feedback on how you experienced the illness and compare it to my own experiences and my observations of my sister. One thing that I find very interesting is that many of the things that people describe in psychoses, I have also felt or done myself, and I wouldn't have previously thought that I was ill. And I'm sure, like you, no one around me would have seen or thought that I was actually ill. For me, it was simply my own internal dialogue, and I found it strange that you attributed it to psychoses. So I would like to dig more deeply into that with some follow-up videos. In my next video, I'll explain the risk factors for schizophrenia and how they align with my ideas and theory for the cause of schizophrenia based on hypersensitivity and our brain's processing capacity. If you find this video useful and informative, please like and subscribe, and give me your feedback in the comments below. I'm interested to know if you think what I am describing matches your experiences or not.